Thanks for joining us on the Momtastics. Today we are discussing postpartum depression, and this is part 2 of our 3-part series. I'm Colleen Shields.
And I'm Jennie Grimm. In our first segment, we discussed what postpartum depression is, how common it is, and why it occurs.
How is postpartum depression different than baby blues?
The baby blues happen really commonly. It's almost to be expected. 50 to 80% of people, of women after birth, within 3 or 4 days, begin to feel a sense of less excitement or enthusiasm than the rest of the family may have. They may feel that they haven't done as good a job as they could. They may not be just joyful about it, all that's going on. That usually goes away within 10 days to 2 weeks. The postpartum depression starts at about that time, and it can start a little later. It's more serious, it lasts longer.
What are some of the signs and symptoms that women who are experiencing postpartum depression display?
Feeling sad, crying, difficulty sleeping, difficulty having appetite, not wanting to eat, wanting to be alone, wanting to be withdrawn, being grouchy, not coming back, and which not just for an afternoon or because of something was on, but it stays consistently and it doesn't come back, and it can last for months.
What are some key things that a spouse can do if they suspect that their wife has postpartum depression?
Listen. It's really important that significant others get a chance to listen, to take time, give them a break, to share on responsibilities, all the things that signal that give them a chance to take care of themselves and give them an opportunity to feel appreciated. It may seem like it's a little thing to do. It's extremely important.
Thank you so much for joining us today.
Thank you very much.
Thanks so much for joining us on the Momtastics. For these tips and more information, please visit our website, themomtastics.com. I'm Jennie Grimm. Welcome back to the Momtastics for the 3rd installment of our 3-part series on postpartum depression.
I'm Colleen Shields. On the first 2 sections of our 3-part series, we discussed how common postpartum depression is, why people have it, and what's the difference between postpartum depression and baby blues. But today we want to know, Dr. Hibler, how do you treat postpartum depression?
Embrace it. Recognize that it's there. For the family, to be there for the person, to help her out, to give her the break. But also all of the other treatments that we have for depression all work, all of them, whether it's therapy, whether it's groups, whether it's working with medication. All of those also will work.
Dr. Hibler, how long does it take on average to treat postpartum depression?
It depends on the severity. Usually it's several months, but it can take a longer period than that.
Are there any alternatives to traditional medicines when treating postpartum?
Getting back to a routine is a great idea. Being able to get back to the things that you value, the things that are important, the things that normally charge your battery and keep you running. That's really helpful to do that. The problem with the postpartum depression is it's really hard to get back to doing that. But the sooner you can do that, and anything anybody can do to help them is really helpful.
Well, thank you so much for joining us. This has been incredibly enlightening. Thanks so much for joining us on the Momtastics. For these tips and more information, please visit our website, themomtastics.com.